Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. Midwestern states have a mixed record on fighting lung cancer. That's according to the latest State of Lung Cancer report by the American Lung Association. And when it comes to Missouri, the ALA found the state ranking high in rates of new lung cancer cases. Missouri also came in fourth in the nation for lung cancer patients receiving no treatment after diagnosis. Joining me in studio to talk about that report, we have Kavahn Mansouri, an investigative reporter with KCUR and the Midwest Newsroom. Great to have you back.
Good afternoon.
We also have Laura Turner, Advocacy Director for the American Lung Association in Missouri and Arkansas. Hello, Laura.
Hello.
Welcome to you both to the show. Now, Kavahn, we introed this discussion with wording from your story that the battle against lung cancer in the Midwest is mixed. What does that mean?
Yeah, so the report, as you'll hear and you can read, found that the states are kind of indeed have a mixed bag. There are the rate of new cases in Missouri and Iowa are among some of the worst in the nation. Meanwhile, in Nebraska and Kansas, two of the other states the Midwest Newsroom cover, they're sort of at or just below the national average. But Missouri is actually the sixth worst when it comes to new cases, and I believe Iowa is the 12th worst. Mm-hmm. Among that, there are also struggles with survival rates and things of that nature. But they're actually from members of the ALA that I spoke to. There's actually hope. And some of the survivors I talked to, there's some hope in that report as well about improvements in survival rates nationwide and things of that nature. But in the region, there are there's good and bad. And you can look at the report yourself to it breaks it down by many different categories of metrics of successes. And I believe you'll hear from Laura that there is work to be done. There's also successes in other places. So, yeah.
Now, Laura, we've talked about Missouri because that's where we're sitting right now. What is it that is unique to Missouri that's led to a high prevalence of new lung cancer cases?
I think the thing that sticks out the most is we have the lowest tobacco tax in the nation. And we know research shows us that having a higher tobacco tax really can deter rates of new smokers and help people quit. Mm-hmm. And I think that's probably the one that sticks out the most to me. But I think in general, we have some work to do on better awareness around that. And
So as far as something that's visible or that we can smell, it does come to that first. Now, Kavahn, you also spoke with regional ALA director Christina Hamilton, and she told you about some of those improvement areas and then challenges in others. Where were the improvements again?
I spoke with Christina. She I believe, oversees Iowa and Illinois, but kind of spoke for the region. There were improvements. I believe in some areas there was lower rates. Actually, Missouri and Iowa actually saw a lower rate of new cases, but still ranked among the worst. Mm-hmm. So that was actually an improvement. As for the other improvements, there's a lot of ups and downs there. Yeah. I would probably recommend taking a look at the report because it does get into very finite metrics.
And one of them has to do with survival rates for people of color nationwide, which was a metric that was tracked to help reduce health disparities. So that does seem like it is a bright spot, but that drop in lung cancer rates that Kavahn has just mentioned between 2022 and 2023, is that part of a longer-term trend, Laura, or is it just a one-year blip?
I think a lot of times the reason for that kind of is revealed later on when we're able to dig more into the data. But I do think it's hopeful, and I think it's a sign to continue doing more of what we are doing that works. Tobacco cessation, helping people quit, better coverage in Medicaid, of helping people quit smoking, that sort of thing. That's happening.
So with something like vaping, that's another way that people are bringing something into their lungs that's not supposed to be there. Were there any insights that came from this particular set of data regarding that?
That's not a measure that the State of Lung Cancer Report looks at right now. It's still into kind of short as terms of cancer risk, still kind of a short period since when people started using vapes and e-cigarettes. But what we do know, and I was looking into this, there is an ingredient that can cause lung cancer in a lot of vapes.
Yeah.
But we just don't have the long-term data yet there.
So it's something to keep an eye on.
To keep an eye on, yeah.
Now, Missouri ranks fourth, as Kavahn had mentioned, fourth in the country for lung cancer patients who do not receive treatment after diagnosis. What are some of the situations that lead people not to get treatment after they've learned that they have lung cancer?
I would say that probably one of the biggest ones would be not having health care coverage. And back to the Medicaid issue, we've had Medicaid expansion for a few years, and that means more people have access to treatment. So I couldn't directly attribute that, but I'm sure that's a factor.
Yeah. Kavahn, you spoke with someone for your story, for the Midwest Newsroom, and that person is Sarah Guykin, who's a 43-year-old Iowa woman, and she was diagnosed with lung cancer in 2019. Talk with us about what she told you about her experience and maybe how it reflects key findings in the ALA report this year.
Yeah, Sarah's a kind of inspirational person to talk to, but also a kind of I think a good example of someone. She was a low risk individual, someone who didn't chart as someone who was probably likely to get lung cancer, didn't smoke or anything like that. And after an exercise class, she actually already had been volunteering with the ALA for years. But after an exercise class in 2019, she felt what she kind of described as like she had pulled a muscle. Turns out it was stage 3 lung cancer, which has actually progressed. But she is, she told me on the phone in our conversation that she just wanted to make it to, see her daughter graduate from high school. Well, she did that, 2-3 years on, and now she's hoping to make it to college. And that kind of speaks to these 5-year survival rates, which are, I think, good news for everybody. I know my mother-in-law is a lung cancer survivor and she is getting towards that 5-year mark, and that makes everyone hopeful. But Sarah was interesting because she wasn't someone who smoked. But she went and got a screening because she was well educated to know that there might be something wrong, and she caught it. Unfortunately, not as early as maybe somebody would like to. Stage 3 is pretty progressive, and unfortunately, she is terminal.
Right.
But it just goes to show that screening rates, people need to know to go and get screened if they might be someone who's at risk, and I think that really speaks to this. And something Sarah told me in our conversation is that even though her time might be limited, I shared the results of that report to her, and she said, it's fantastic. It gives me some hope that I can keep going for a few more years, or long enough to see out these important things in my life, see my daughter graduate from college, things like that.
Those milestones. Laura, is there anything about Sarah's story that provides kind of a backdrop for explaining why it is people don't get screened for lung cancer?
Well, it sounds like, if I heard it right, in her case, she wasn't high risk for lung cancer, and she hadn't been a smoker, and that's what puts people in that high enough risk category. So I'm kind of curious to find out how she was able to get screened. It's wonderful that she was. So I don't think she really exemplifies the people who could get screened and don't. I think she's one of the extra careful and lucky ones. Yeah.
So for lung cancer screenings, who's eligible for that? And what does a screening entail?
So And let me backtrack. I wouldn't say anybody's lucky if they get lung cancer.
Sure,
I just
sure.
mean that it's always hopeful when someone can find it earlier than later. And I wish her the best. So the people who are eligible for lung cancer screening are people between ages 50 and 80 who have smoked either a pack a day for 20 years or 2 packs a day for 10 years. And then their smoking status, they either right now need to be either a current smoker or quit smoking in the last 15 years.
Okay. So it's heavily sort of looking at those who are habitual smokers. And then in Sarah's case, I mean, she was not a smoker and quite young, so sort of not in that category. Are there other things that prevent people from going to get a screening apart from insurance? Like, is there some stigma involved?
Definitely stigma. And I think it's tricky because while we know that tobacco is a leading cause of lung cancer, we also know, secondhand smoke is right up there with it. And that doesn't mean that you smoked. And also, nobody deserves lung cancer.
Right.
Tobacco is a very addictive substance. We know that. There's so much complexity there.
Yeah.
But so I think that might keep people from, the stigma definitely might keep people from it. And also not knowing as much about the survival rates now and the treatment options. When you don't think you have hope,
Yeah.
I think it's harder to face that.
Right. And radon is also something that was mentioned in the piece. Kavahn, it came up in the conversation that you had with that ALA regional director. What is one word about radon that we should be keeping in mind here?
Yeah. I remember watching The Office many years ago, and the character Toby says radon's a silent killer. But basically, it is the second leading cause of lung cancer in America. And it's something that needs to be tested for in homes regularly, especially when you have new things installed like a HVAC, things like that. So.
So you can check out Kavahn's piece at stlpr.org. It's got a link to resources via the American Lung Association. Kavahn Mansouri is investigative reporter for the Midwest Newsroom, and Laura Turner is advocacy director for the American Lung Association in Missouri and Arkansas. Thank you both for joining us today.
This episode was produced by Emily Woodbury
and by Elaine Cha. Audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
St. Louis on the Air proudly supports local artists by using music from Life Creative Group.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.